Hello everyone, Dr. Jonathan Millard here to talk to you about the anatomy of typical vertebrae. So the vertebral column extends down from your head and it's comprises different regions. So the highest region or the most superior region is the cervical region. It has 7 vertebrae. More inferiorly you see the thoracic region, which has 12 vertebrae. Next the lumbar region with 5 vertebrae, individual little bones. Inferior to the lumbar region we see the sacrum, and the sacrum is actually made of 5 fused vertebrae. And then last, but definitely not least, hanging off the end of the sacrum, we see the coccyx, which comprises 4 fused vertebrae. So the sacrum and the coccyx really made of fused vertebral elements. So I'm bad at math, and that's why I teach anatomy. But even I can add these together. So 33 vertebrae, on average, you should have inside of one vertebral column. Now these vertebrae have different orientation. So essentially this view over here is an anterior view, so looking straight on. If you were to look at the vertebral column from the side, you would note that it has curves to it like this. So from a profile view now, coming down from your head, the way these 7 cervical vertebrae are arranged are such that it creates a curve. And we call this curve, which is a concavity facing posteriorly, we call this a lordosis. So this is the cervical lordosis. Moving down from the cervical lordosis, we see the thoracic region actually has a curve which faces the other way. The concavity is facing anteriorly, so we call this a kyphosis. Kyphosis is a term that's used clinically, but everyone should have a natural kyphosis in their spine. So proceeding inferiorly from that, the lumbar region will have a lordosis, similar to the cervical region. Then last but not least is a kyphosis in the sacral region. So you see, if you pick up on like a nice little pattern there, where the cervical region starts lordotic, moving into a kyphotic thoracic spine, alternating to a lordotic lumbar spine, and then finally a sacral kyphosis. The way I remember this is the lumbar region starts with L, so L lordosis, and everything alternates from there. So alternates inferiorly and superiorly, so to a thoracic kyphosis, and then alternating again to a cervical lordosis. So we're going to talk about features of a typical vertebra. Some atypical vertebrae will be featured in other videos, but for typical vertebrae, I've chosen the T8 vertebrae. So this is a superior view, so we're looking down on a T8 vertebra, and let's talk about the features that you would typically see in a typical vertebra. So the first thing that we want to point out here is the vertebral body. So this large piece up here in the front that will bear a lot of weight. As the vertebral column is a bunch of stacked bones, we see the vertebral body here in red. And then behind the vertebral body, we see this arch of tissue. So this arch right here is known as the vertebral arch, and it's got a lot of decorations and things hanging off of it that we'll talk about in a minute. So this vertebral arch here in green, hanging off of the vertebral body, which is more anterior. So in addition to these 2 primary features, we also see a bunch of little decorations, as I mentioned, hanging off the sides, and we call these processes. So in anatomy, when you're talking about the skeleton, if you hear the word process, you're thinking something poking away. So the first process I want to talk about is pointing behind. There's just one of these. We call this a spinous process. So the spinous process, you see one of them in the midline, pretty dominant little feature here posteriorly. You'll see 2 transverse processes pointing off into the left and right direction, so transverse processes here, and then articular processes. So you'll see 4 total articular processes per vertebrae. You'll see 2 on the top and 2 on the bottom. And since this is a superior view, I can only see the superior articular processes here, and they're pointing out, they're coming out of the picture toward us in this case. I can't see the inferiors, they're tucked under, and they could be seen from the inferior view. Okay, so these are the primary elements of a typical vertebrae. So we can add a little bit more meat on the bone here, no pun intended. So let's start with what we know. So we know the transverse processes hang off the side, the spinous process, one single midline structure, and then the vertebral body here. So there's a little more subtlety to it. So another feature we may see here is the epiphyseal rim. So the epiphyseal rim is derived from the annular epiphysis in development, whereas the vertebral body derived from the centrum. The epiphyseal rim tends to be this smooth kind of bony feature, whereas the vertebral body typically looks sort of spongy like this. Okay. Other things that we know, well, we know the vertebral arch. We know the vertebral arch is the part that's hanging off the back of that vertebral body. And what we need to know about it, a couple of other features. One feature is called the lamina. So this portion back here that's going to merge together at the location of the spinous process, these are the laminae, or lamina singular. In addition to that, we see the portion of the vertebral arch that's connecting it directly to the vertebral body. So these connection points are called pedicles. So the pedicles on either side and the lamina together here, these laminae, they make the vertebral arch together. We also note that the vertebral arch, together with the vertebral body, consequentially will form a hole. So a very dominant hole in the middle. This large hole is known as a vertebral foramen. And the spinal cord is communicated through the vertebral foramen. And as the vertebral column is stacked, one vertebra on top of the next, the vertebral foramen would become a continuous canal known as the vertebral canal. Okay, good. Moving on, looking at a lateral view now, almost done. Some things we know. We know the transverse process. Here's a spinous process. There's our large vertebral body we would see anteriorly. Remember that spinous process, that long, unpaired midline structure. Here, this is a thoracic vertebra, so it tends to be quite long and pointy. Some other things we see. We know this guy poking up here is the superior articular process. So this whole piece here pointing up is the superior articular process. And if you notice closely, it's got this sort of flat surface. So this flat surface here is known as the facet, or the articular facet. So this implies that this flat surface is going to articulate with the vertebra from above. Okay, so one would say that the articular facet, or the articular surface, the smooth surface, is a feature of the greater articular process here, in this case the superior articular process. Recall there's 7 processes, so there's 4 total articular processes, so you have 2 inferior articular processes which are sticking down, okay, and they would have their own facet, which would be kind of aligned along this border, but I can't see it from this lateral view. Okay, so superior articular process above, inferior articular process below, 2 of each per vertebra, and each one will contain their own flat little facet, which will allow for articulation with adjacent vertebral elements. Other interesting things, we see a pretty notable notch that's carved out below where the pedicle would sit, okay? This is called the inferior vertebral notch. So the inferior vertebral notch, kind of as the name implies, you expect to see a superior, so there's a superior vertebral notch that would be just above it. So more on that in just a second. So superior vertebral notch and an inferior vertebral notch. Okay, moving on then, looking at 2 of these articulated together. This is an articulation between the T8 vertebra and the T9 vertebra. So it's these processes, these facets, and some of these notches have some interesting coordination with each other that's important to talk about. So a couple of these that we know the inferior articular process and the superior articular process that we just mentioned. So the superior articular process from the previous slide we know has a smooth facet, and that facet would articulate with the inferior articular process from the superior vertebra, and that's what we see here. When these two come together, they make a joint called a Z-joint, or a zygapophyseal joint. This is a synovial joint that exists between adjacent vertebral elements within the spine. Okay, Z-joint or zygapophyseal joint. Also of interest here is this little hole that's formed. So we have a little hole that is formed from the subsequent articulations here of these vertebrae where their notches come together. So recall the inferior vertebral notch and the superior vertebral notch. So the inferior vertebral notch of the vertebra above will make a complete little hole along a partner beside the superior vertebral notch from the vertebra below, and we can see this little hole now form from these notches. So the hole that's formed between these notches at every vertebral level here is called the intervertebral foramen. So the intervertebral foramen is quite important as it will communicate spinal nerves that will exit from the spinal cord and be distributed over the body. Be careful, though, that the intervertebral foramen is not confused with the vertebral foramen that we discussed previously. The vertebral foramen is formed from the location of the vertebral body here along with the neural arch. So the vertebral foramen continuous is the vertebral canal as you stack all the vertebrae together. The intervertebral foramen, inter meaning between, is formed from adjacent vertebrae here on the side. Okay, that's all I think for typical vertebrae. I hope this helped. If you have any questions, always feel free to reach out, and thanks for watching.